was the summer, things were wide open and quite optimistic.
Norm Chu has been looking forward to his family's March break ski trip to Vermont since last summer. It's their first one since the pandemic began, but he's still weighing the risks.
The biggest concern is the PCR tests returning to Canada. So if one of us tests positive, we have to isolate for at least 10 days in the States.
With spring break coming up, many Canadians are calling their travel agents with a pent-up desire to travel.
People have been in their homes, working and living, and wanting that, and just desperate to physically remove themselves, get a mental break.
But some are having second thoughts, especially because of that requirement to show a negative PCR test to come home.
The benefit of this is not really clear.
This infectious disease physician says at this point in the pandemic, Canada's testing rules for travelers no longer make sense.
We have to recognize the risk of getting COVID on our soil is starting to even out to getting the COVID on foreign soil. And, that really does put a wrench into us restricting travel.
What's more, he says, anyone who's had COVID but couldn't get a PCR test in Canada to prove it when they were sick will have to do one to come home from abroad. And Chagla says there's a risk they could still test positive weeks after infection, even if they're no longer contagious. Airlines have also been pushing the federal government to ease some travel restrictions.
We really do feel now is the time to have a real conversation about some of these measures and why some of them are in place and which ones we can do without and still keep people safe.
The Public Health Agency of Canada says border measures are there to protect Canadians' health and safety, and says the government will continue to review, lift, or adjust them as required. Alison Northcott, CBC News, Montreal.